Hello everyone, I'm Dr. Adam Maulana. How are you today? I hope you and your family are always blessed with good health, peace, happiness, and protection in everything you do. Thank you for joining me again and taking the time to learn about ear and hearing health. Today, we're going to discuss a question that many people ask. Is it normal for hearing to be reduced in just one ear? This is an important question because changes in hearing on one side can have many possible causes. Some may be temporary and relatively minor, while others may require further medical evaluation. Hearing in both ears does not always feel exactly the same. In certain situations, a person may temporarily feel that one ear hears slightly less clearly than the other. One relatively common cause is earwax buildup. Earwax, or cerumen, is actually a normal part of the ear's protective system. It helps maintain moisture in the ear canal and traps dust and small particles. However, when earwax accumulates and forms a blockage, the pathway that carries sound toward the eardrum can become obstructed. As a result, sounds from that side may seem quieter or more distant. Another possible cause is a change in air pressure. This is commonly experienced when traveling by airplane, particularly during takeoff and landing. Rapid changes in pressure can make the ear feel full, blocked, or temporarily different in terms of hearing. Normally, the ear works to equalize pressure through the Eustachian tube. In addition, certain changes involving the ear canal or middle ear can also cause a sensation of fullness and altered hearing. Because several conditions can produce similar symptoms, we should not immediately assume the cause based only on the sensation of a blocked ear. Another important factor is how long the hearing change lasts. If hearing returns to normal after a temporary factor is resolved, this is different from a situation in which hearing continues to decrease or does not return to its previous level. We should also pay attention to other symptoms that may occur at the same time. For example, is there ear discomfort, fever, dizziness, ringing in the ear, persistent fullness, or unusual discharge from the ear? This information can help a doctor understand the possible cause and determine which examinations may be necessary. One situation that deserves particular attention is sudden hearing loss in one ear. Do not immediately assume that it is simply caused by earwax. Sudden hearing changes require prompt medical evaluation so that the underlying cause can be identified and appropriate management can be considered. When you consult an ENT specialist, the doctor may examine your ear using an instrument such as an otoscope. If necessary, the doctor may also recommend hearing tests, including audiometry, to assess hearing ability in each ear. These examinations can help determine whether the hearing change may be related to the outer ear, middle ear, inner ear, or another part of the auditory system. I would also like to remind you about a common habit people may have when their ear feels blocked: inserting a cotton swab too deeply into the ear canal. This should be avoided. Cotton swabs do not always remove earwax. When inserted too deeply, they can actually push earwax farther inside, making it more difficult to remove. Therefore, when one ear suddenly seems to hear less clearly, avoid trying different methods without knowing the underlying cause. Pay attention to your symptoms, avoid actions that could disturb the ear, and seek professional evaluation if the problem persists. The educational discussion in this video is based on information about ear health, including reference material from Clinic Al-Biruni, and has been summarized to provide a clearer understanding of changes in hearing affecting one ear. So, does reduced hearing in one ear always mean that something serious is happening? Not necessarily. Some causes can indeed be temporary. However, we should not assume that every change in hearing is normal, especially when the problem persists, becomes worse, or occurs suddenly. The most important thing is to recognize the change and take the appropriate steps. A professional evaluation can help identify the actual cause so that management can be tailored to the individual's condition. And the moral of the story is this: don't panic when your hearing changes, but don't ignore it either. Pay attention to the signals your body gives you, take care of your ears properly, avoid excessive ear cleaning, and don't hesitate to consult a doctor if the problem persists or appears suddenly. Because hearing is more than just a bodily function. It is a bridge that connects us with our families, our work, our surroundings, and the many precious sounds of everyday life.